Hello everyone, welcome to sqadia.com, and in our final section of the lecture topic genitourinary problems we will talk about syphilis. And in this section we will talk how the syphilis is caused, what are the different classification or stages of syphilis, what are some complications of syphilis, and what are clinical features and treatment of syphilis. The bacterium treponema is caused by syphilis is caused by Treponema pallidum and subspecies pallidum. So Treponema pallidum is the bacteria that causes syphilis. It can be congenital when it is acquired through birth or by birth it's present, and it can be acquired. It is divided into 3 stages. In the first stage, usually there is a sore chancre. This is the sore in the first stage of syphilis is known as the chancre, and it's present at the side of the entrance of the Treponema pallidum. And this stage lasts from 3 to 90 days after exposure. In the second stage of syphilis, there is a body rash, and this body rash usually appear on the, you can see it's all over the body, but usually on the palm and the sole. And this stage lasts 4 to 10 weeks after initial infection. And then in the third stage, this stage affects the internal organs, liver, heart started involved, brain. So all these organs are involved. Bones are also affected, and this is 3 to 15 years after the initial infection. So it's a long-lasting disease, and it can slowly start affecting all the internal organs of the body, in which liver, heart, brain is involved. Some of the complications of the syphilis, neurological complications in which there is meningitis. Meningitis is the inflammation of the meninges of the brain. Meninges are the coverings of the brain that covers the brain and the spinal cord. So these are the infection of those meninges is meningitis. Eighth nerve palsy. Eighth cranial nerve is the vestibulocochlear nerve. Vestibulocochlear nerve paralysis occur that can lead to deafness sometimes, and tinnitus is also present in patients with syphilis. Tinnitus is a ringing sound that is heard in the ear. Patient complain that they keep on hearing ringing sound in the ear. Then ophthalmic involvement of syphilis is uveitis, in which ciliary body choroid is involved, which is the uveal tract. So it's the infection of the uveal tract. Some late complications of the syphilis are gummatous lesion. Gummas are the granulation tissue lesions in which they are big raised lesions present on the skin and the bone. Then some late complications also involve the heart, and then the brain and nervous system is also involved. Diagnosis of syphilis is mainly by serology, which is the test done on the serum. And serum, as I told you before, is the liquid portion of the clotted blood. So you let the blood clot, and the serum that's separated from that blood is the tests are done on that serum. The direct test done to find out the Treponema pallidum, and then RPR. RPR is rapid plasma reagent testing is done to find out or to diagnose the syphilis. Then the other test is VDRL, which is venereal disease reference lab testing is done. Now, some common complications early and late Clinical features and the treatment of syphilis. These are some presentations early within 2 years. How it presents: there might be a rash, then there are some hemorrhagic rhinitis. Rhinitis is the inflammation of the nose, so that leads to bloody snuffles. Or there can be lymphadenopathy is very common. There is enlargement of the lymph nodes, then hepatosplenomegaly. Once the internal organs start affected, there is involvement of liver and spleen, lymph nodes, then different skeletal abnormalities are also present. Before, in the earlier ages, when there was no treatment of the available, patients with syphilis slowly, once the disease progress and then all these problems occur, usually they put the patient in isolation and they put them in some caves or somewhere where they have no contact with the other humans. But now things are getting better and treatment options are available. Some other manifestations are condylomata. These are also these skin lesions like ulcers. And then there is osteochondritis, involvement of the bones and cartilages. Then there are mucus patches. Then there are involvement of kidneys. Slowly glomerulonephritis occur, and there is ocular involvement, hemolysis, thrombocytopenia. Again, it's multi-system disease. With time, slowly it involves all the systems of the body. And some late features of the syphilis is there is a sensory neural deafness. Dental abnormalities are common, known as Hutchinson's incisors and Mulberry molars. In Hutchinson's incisors, the teeth are thin, and there is usually the pointed ends on the top. They are pointed. There is also frontal bossing, prominent forehead, short maxilla, and then some neurological involvement include intellectual disability and cranial nerve paralysis. Cranial nerves, there are 12 cranial nerves, and there is one of them, we went over that eighth nerve involvement is very common, which is the vestibulocochlear nerve. And also other nerves slowly become infected or involved also. So syphilis is a multi-system disease, and as the time passes, it can involve different systems of the body and can lead to very crippling and disabling condition. Treatment of the syphilis is penicillin, is injection are given to this depot preparation of the penicillin. And if person is infected, then there are other treatment available too, but penicillin is the treatment of choice for syphilis, and different other regimes are also available for different stages of infection. So it occurs in different stages: primary, secondary, tertiary, latent, depending on how much time is involved in the infection. So that was all about the syphilis and how it presents and how it is diagnosed and treated. Thank you for watching sqadia.com.